The Affordable Care Act is a landmark achievement that will save huge sums of money for our nation while extending health insurance coverage to millions of people. They're the ones that get up early. They get the early bus. They work hard. They give it everything they've got. They're our mothers, our fathers, our friends. They're like Tyrone, the gentleman who lived down the street from me, who died, and the last word he said to his wife on his sick bed was, "Marie, I got to get up out of here. I ain't got no insurance." Talking about them, our fellow Americans, the ones who send us here. Just yesterday, women in private health insurance plans became eligible for life-saving preventive health screenings with no copays. This is part of the Affordable Care Act's comprehensive effort to save money by focusing on prevention. These are the women in our lives, our nieces, our daughters. It also addresses the historic disparities women face when paying for health care. The Affordable Care Act also has begun to ensure that seniors, like my mother who is 86 years old, have access to preventive care. Young adults have access to insurance on their parents' plans, and individuals are no longer subject to lifetime limits on their care. While all of these reforms are being realized now, many significant changes are yet to come. The Internal Revenue Service is a key agency charged with implementing many of the Affordable Care Act's provisions by 2014. This is a considerable undertaking for the IRS, but we can do this. Experts from the Government Accountability Office, the Inspector General's Office, and the National Taxpayer Advocate have reviewed IRS's efforts to date, and they have concluded that the IRS is on the right track to successfully implementing the new law. I have said it to my constituents, and I have said it to my family. The 30 years that I've been in public life, there is nothing that I have done, no vote that I have cast, that I'm more proud of than the Affordable Care Act. And the reason why I say that is because I see the people who will help, and I know that there are people who will die without it. And I will say that as we address this IRS issue, this is the United States of America. We can do this.